Hi guys. ABGs can feel confusing at first, but once you understand the steps, they become so easy. In this video, I will explain ABGs step by step by using simple language and examples for nursing students. If you see I'm looking down, that means I'm using my note in here. So this is the note I'm going to use. Step 1. What does pH mean? First, we always look at the pH. pH stands for potential of hydrogen. pH tells us if the patient is acidosis or alkalosis. The normal pH is 7.35 to 7.45. That means if the pH less than 7.35, that's acidosis. And if the pH is greater than 7.45, that's alkalosis. That's step 1. Step 2, what does CO2 mean? Next, we look at CO2, also called carbon dioxide. Carbon dioxide is controlled by the lungs, so it represents the respiratory component. CO2 is a part of carbonic acid system. Normal CO2 is 3.5 to 4.5. The way I memorize is, if you look the pH, you will see the pH is 7.35 to 7.45. And if you hide the 7, you will see same number, similar number to same number with to CO2, which is 3.5 to 4.5. That's the way I memorize those numbers. So the more CO2 means more acidic, and the less CO2 means less acidic. That was the second step. I hope you understand. Now let's talk about HCO₃, which is also called bicarbonate. Bicarbonate is controlled by kidneys. It also represents the metabolic component. The normal bicarbonate is 22 to 26. The way I remember is CO2 equal lungs equal respiratory, whereas bicarbonate equal kidneys equal metabolic. Step 4. Let's talk about raw method. Oh my god, you guys cannot believe how much this method did help me to understand and to identify the disorder. And I will show you how to use this method. Okay, raw method means respiratory opposite, metabolic equal. That means if the pH and CO2 are moving opposite direction, that's a respiratory issue. And metabolic equal means if the pH and HCO2, which is bicarbonate, are moving same direction, that's a metabolic issue. That's how you know. Let's give an example. Let's say in here, the pH, we already know the pH is less than 7.35, it's an acidosis. If the pH is greater than 7.45, it's alkalosis. So now we have a pH 7.25. That means the pH is low, which means it's lower than 3.5. So it means it's acidosis. And then we have in here CO2 equal 49 in here. 49, that's a lot. That the normal CO2 was 3.5 to 4.5. So this means high CO2. That means the pH and the CO2 are going opposite side. One is high, one is low. That's, we know, we already know it's acidosis, which is the less than 3.5. But we also know it's a respiratory issue because of they go in opposite side. One is high, one is low. That's a respiratory acidosis. Now let's talk about the metabolic. Okay, we're gonna look the pH. So the pH I have in here is 7.55, which means it's higher than 7.45. That's high pH, which means higher than 45 is alkalosis. And then we have in here bicarbonate. the normal bicarbonate was 22 to 26, and now we have in here 29, which means it's higher than 26. Those are going same direction. I mean, both of them are high. The pH is high and the bicarbonate is high, which means it's metabolic issue, and we already know it's alkalosis, which is metabolic alkalosis. I hope that's helpful, guys. Okay, that was the raw method. That's how I understand the raw method. So now let's talk about respiratory acidosis. Is low pH, high CO2. Causes could be hypoventilation, COPD, airway obstruction, sedation like opioid. Signs could be confusion, lethargy, headache. Treatment could be improve ventilation and treat the causes. So now let's talk about respiratory alkalosis, which is opposite of respiratory acidosis, which means the pH is high and the CO2 is low. Causes could be hyperventilation, anxiety, panic attack, early pneumonia. Signs could be headache, tingling in fingers, and the treatment is slow breathing. Treat the anxiety, because this patient has a panic attack, which means you're gonna slow down the patient. So now let's talk about metabolic acidosis. Metabolic equal. Now the pH and the bicarbonate are going same direction, which is both are low. They go in same direction. Causes could be DKA, renal failure, diarrhea. Signs could be Rosmal respiration, which is deep rapid breathing. Treatment could be treat the causes, IV fluid, or insulin if it's DKA. So the way I remember this, below the waist, which is the diarrhea, by base. Diarrhea cause loss of bicarbonate, leading metabolic acidosis. Finally, let's talk about metabolic alkalosis, which is opposite of metabolic acidosis. Now the pH and bicarbonate are high. Causes could be vomiting, NG suction, diuretic drugs. Signs could be muscle cramps, weakness. Treatment also could be IV fluid or electrolyte replacement. If you see in the exam a patient vomiting for several days, that means vomiting is above the waist, which means it's metabolic alkalosis. And my final advice to you guys, ABGs, is all about staying systematic. Always check the pH first to see if the patient has a acidosic issue or alkalotic issue, and use the raw method to determine if the patient has a respiratory issue or metabolic issue. And don't overthink it. Practice makes perfect. Whether it's that DKA, whether it's diarrhea or respiratory issue, you got this. And thank you for watching. I think that's it for today. Bye for now.